Good day, everyone. I am Joseph Bahian Abang, and I'm actually here to discuss the answers of our prelim exam, and which is actually focused on the care of clients with physiologic and psychosocial alterations, Part B. And my assignment is B1, which is care of other clients in acute biologic crisis. So we'll have 12 questions for this. Let's begin with question number one. The hospital administration issues a statement that surge capacity is likely to be exceeded because statewide measures have not been successful in flattening the curve of COVID-19 or the coronavirus cases. How is this information most likely to affect the nursing staff? A. Nurses will be expected to revise infection control policies as needed. B. Nurses will be asked to work extra shifts or keep working beyond end of shift. Letter C, nurses will be given priority usage for personal protective equipment. Or letter D, nurses can temporarily practice outside scope of practice as needed. Of course, since this is actually talking about infection, so our focus here is not about infection, but it's talk about flattening the curve. So when you say flattening the curve, it means that it talks about the number of cases that is infected with COVID-19. So eliminate natin yung letter A at saka letter C because they have the same thought. Because letter A talks about infection policies and letter C talks about PPE, which is actually one way of addressing infection. So we're left with B and D. So letter D is talking about beyond our scope of practice, and letter B is about working extra shifts or working beyond a shift. So when we talk about flattening the curve, it means that it talks about the number of cases and the number of personnel required. Answer for number one is letter B. Of course, we know that nurses are likely to be asked to work additional shifts or hours as the patient load increases. And when the surge capacity of a hospital is exceeded, a sudden and unexpectedly large number of patients overwhelm the resources and capabilities to provide care. So by flattening the curve, we know that when there are fewer infections, so patients enter the healthcare system at slower and more controlled rate. And infection control policies have not been affected by the pandemic, but there's a need for us to have revision of policies and guidance for nurses would have occurred in anticipation of the surge as part of the disaster preparedness planning. While nurses should be among those who will get personal protective equipment, other staff members, patients, and visitors may also receive first priority. And nurses cannot legally practice outside scope of practice even in emergency situations. So in this case, it's very important for us to remember that when you talk about cases, then you talk about the number of personnel required. Answer for number one, B. Number two, an emergency department clinical nurse specialist is training staff in how to don and doff personal protective equipment when caring for patients with infections such as Ebola. Which staff member has demonstrated the most grievous error during the practice session? So, when we say grievous, it means that all of these staff nurses committed a mistake. But which of these actually made a very grievous error then? Letter A, a triage nurse forgets to perform hand hygiene and inspect PPE before donning. Letter B, an assistive person performs self-inspection, then begins to doff PPE. Letter C, a healthcare provider forgets to wipe shoes with disinfectants after doffing shoe covers. Letter D, an emergency medical technician doffs both pairs of gloves first. Of course, all team members have made actually an error, but removing both pairs of gloves puts the emergency medical technician at greatest risk because the other surfaces the other surfaces of the remaining PP are considered contaminated. So the best answer for uh number two is letter D. It should be letter D. So typo error, it should be letter D. An emergency uh medical technician does both PPE both pairs of gloves first. So it should be letter D. So, according to the latest recommendations from the Centers of Disease Control and Prevention, the flow of donning is as follows. So, a trained observer arrives to oversee the inspection process, and team members removed personal clothing items, inspect their PPE, put on their boot covers, and then don in this order inner gloves, gown, N95 respirator, hood, outer gloves, and face shield. And afterward, the team members inspect themselves and are expected by the trained observer the flow of doffing, Starts with an inspection by the team member and by the trained observer, and afterward, team members disinfect outer gloves, remove their apron if that is actually used, and at the same time inspect the apron for cuts or tears, disinfect, and of course inspect and remove outer gloves, inspect and disinfect the inner gloves, and remove face shield, disinfect inner gloves and remove hood, disinfect inner gloves, remove gown, disinfect inner gloves, remove boot covers, then disinfect this and change inner gloves and remove N95 respirator, remove boot covers, disinfect and change inner gloves, remove N95 respirator, disinfect inner gloves, disinfect washable shoes, disinfect and remove inner gloves, and then practice hand hygiene. So after all that, team members inspect themselves one more time and are inspected by trained observer. So answer for number two, it should be letter D. So typo error, it should be letter D. Number three, the nurse is working in the triage area of an emergency department and the following four patients approach the triage desk at the same time. List the order in which the nurse will assess these patients. So we have an ambulatory dazed 25-year-old man with a bandaged head wound. We also have an irritable newborn with a fever, PTK, and nuchal rigidity. Number three, a 35-year-old jogger with a twisted ankle who has a pedal pause and no deformity. Or letter number four, a 50-year-old woman with moderate abdominal pain and occasional vomiting. So in this case, we'll prioritize a patient that requires an immediate treatment in the emergency department. The one that we're going to prioritize is patient number two, because this actually indicates that an irritable newborn with manifestations of fever and petechial rash should be further assessed because that's actually a manifestation of meningitis. So the patient next is the patient with head wound that needs additional assessment because of the risk of increased intracranial pressure. And third is the patient with moderate abdominal pain is in discomfort. Her condition is not unstable at this point. And then the last is for ankle injury that requires medical evaluation that can be delayed for 24 to 48 hours if that is necessary. And the patient should receive the appropriate first aid. It should be letter C. It should be 2, number 1, number 4, and number 3. 2, number 1, number 4, and number 3. And that is letter C. Number 3, it's letter C. That's letter C. 4. When a primary survey of a trauma patient is conducted, which action would be performed first? A. Obtain a complete set of vital signs measurement. Letter B, palpate and auscultate the abdomen. Letter C, perform a brief neurologic assessment. Letter C, check the pulse oximetry reading. Of course, we know that when you talk about primary survey, it is very important for us to take into consideration the level of consciousness. So therefore, if you're talking about level of consciousness, it should have to be a neurologic check to determine the level of consciousness and at the same time the pupillary reaction as considered to be part of the primary survey. Measuring the vital signs and assessing the abdomen and checking the pulse oximeter reading is considered part of the secondary survey. So here we are trying to look into prioritization. The best answer for number 4 is letter C. Number 5. A 56-year-old patient comes to the triage area with left-sided chest pain, diaphoresis, and dizziness. What is the priority action? Initiate continuous uh, electrocardiographic monitoring. Letter B, notify the emergency department healthcare provider. Letter C, administer oxygen via nasal cannula. Or letter D, draw blood and establish IV access. Of course, when we say the patient is having chest pain, we are expecting that the patient is having angina pectoris or probably progressing towards myocardial infarction. So we know that when that is actually going to happen, there's a problem with oxygenation. Therefore, our priority is letter C, administer oxygen via nasal cannula. Then after that is we have to notify the healthcare provider. Then once the healthcare provider has been notified, then the doctor will refer establishment of IV access for medication administration. And at the same time, the patient should be attached to a cardiac monitor for continuous ECG monitoring. So number 5, the best answer is letter C. Number 6. The patient's blood alcohol level is 0.45%. Based on this information, what is a priority concept, nursing concept that underlies emergency medical and nursing interventions for this patient? A, cognition; B, addiction; C, gas exchange; or letter D, functional ability. Of course, we know that if the level of the alcohol in the blood is actually more than 0.20, so we know that if the level of the blood is if the level of alcohol in the blood is 0.05%, the patient will display presence of euphoria, and probably there is decreased inhibition. And that is if the patient's alcohol level reaches 20.20%, that talks about reduced motor skills, and probably there is an accompaniment of slurred speech. And if that is 0.30%, that will result into problems of alterations of perception, and sometimes patient here will be manifesting double vision. But since a patient is actually having 0.45%, that usually will demonstrate patients have problems with stupor, coma, and of course there will be possibility of decreased respiratory rate. There's possibility of uh, respiratory depression. Therefore, our priority here is letter C, gas exchange. That is letter C. Number 7. According to the Emergency Nurses Association, what are the main issues when seeking when issues when providing emergency care for patients with mental health problems or psychiatric disorders? Select all that apply. Number 1, seeking and ruling out causes for psychiatric behaviors and problems. Number 2, ensuring safety for patients, staff, and others related to restraints, aggressive behavior, and agitation. Number 3, improving length of stay in the emergency department, related to the lack of resources and providing providers decisions about the disposition. Number 4, establishing ongoing care after triage by dedicated psychiatric emergency nurses. Number 5, providing additional education for psychiatric nursing assistants to include care of mental health patients in the emergency department. And number 6, improving communication to describe symptoms of findings in hand of disposition and follow-up care. So here we are talking about uh, issues. So it's actually not an issue if we talk about number 5. So number 5 is actually about education. So therefore, the answer here, it does not require providing additional education for psychiatric nursing assistants to include care of mental health patients in the ED. So that is not directly related, since the patient here is properly being managed if the patient has been admitted to the facility, but not in the emergency room. So number 5 is not an issue. So therefore, the answer here is 1, 2, 3, 4, 6. 1, 2, 3, 4, 6. That is choice letter C. So that is the best answer for number 7. 8. It is summer season and patients with signs and symptoms of heat-related illness come to the emergency department. Which patient needs attention first? A, older adults who reports dizziness and syncope after standing in the sun for several hours to view a parade. Letter B, marathon runners who reports severe leg cramps and nausea and presents with tachycardia, diaphoresis, pallor, and weakness. Letter C, healthy homemaker who reports the air conditioner has been broken for days. She has tachypnea, hypertension, fatigue, and profuse diaphoresis. Or letter D, homeless person who displays altered mental status, poor muscle coordination, and hot, dry, ashen skin. Duration of heat exposure is unknown. So here we are going to prioritize the patient that we're going to be addressing the concern first. So the answer here is that's letter D. Because of course, a homeless person has a symptom of heat stroke, and a heat stroke is considered to be a medical emergency that increases the risk for possible brain damage. So the care includes arterial blood gases, possible intratracheal intubation. There has to be IV fluids, blood for electrolytes, and at the same time, cardiac and liver enzymes, and also complete blood count. Patient might also be receiving benzodiazepine as a muscle relaxant if the patient begins to shiver. And there's a need for us to monitor the urine output and specific gravity to determine fluid needs. And of course, since that's actually heat stroke, therefore there's a need for us to have cooling interventions and discontinuation of cooling interventions when core body temperature is actually reduced already. And of course, the older adult patient is at risk for heat syncope and should be educated to rest in a cool area and avoid future similar situations. So that's going to be our second priority. Third priority is the runner, plus so it's actually having heat cramps, which can be managed with rest and fluids. And the last is the housewife, who's experiencing heat exhaustion, and management includes administration of fluids, be it oral or IV. So the first one is letter D. The second one is actually the older client, that's letter A. Third one is the runner. And the fourth one is the homemaker. Number 8, the answer is letter D. Number 9, the nurse responds to a call for help from the emergency department waiting room. An older adult patient is lying on the floor. List the order in which the nurse must carry out the following actions. Number 1, perform the chin lift or jaw thrust maneuver. Number 2, establish unresponsiveness. Number 3, initiate cardiopulmonary resuscitation. Number 4, call for help and activate the code team. Number 5, instruct assistive personnel to get the crash cart. Of course, the first one that you need to do is, of course, you have to check for unresponsiveness. So that's number 2. It should be followed by number 4, call for help and activate the code team. And it's followed by number 1, perform the chin lift or jaw thrust maneuver, followed by number 3, initiate cardiopulmonary resuscitation, and of course, followed by number 5, instruct assistive personnel to get the crash cart. So the answer here is 24135. That is 24135, and that is letter A. Number 10. Emergency medical services has transported a patient with severe chest pain. As the patient is being transferred to the emergency stretcher, the nurse notes unresponsiveness, cessation of breathing, and no palpable pulse. Which task is appropriate to delegate to the nursing assistant? Letter A, performing chest compression. Letter B, initiating bag valve mask ventilation. Letter C, assisting with oral intubation. Letter D, placing the defibrillator pads. Of course, nursing assistants are trained in basic cardiac life support and can perform chest compressions. The use of bag valve mask requires practice, and usually a respiratory therapist will perform this function, and the nurse or the respiratory therapist should provide assistance as needed during the intubation process. And the defibrillator pads are clearly marked. However, placement should be done by the registered nurse or the healthcare provider because of the potential for skin damage and electrical arching. So number 1, the answer is, number 10, the answer is letter A. Number 11. Although the incidence of tetanus has decreased through routine immunization, there is still a danger. Which patient represents the group that is most vulnerable for risk? Letter A, child who helps on family's farm and sustained scratches while feeding the animals. Letter B, newborn who is delivered in the emergency department, mother had no perinatal care. Letter C, older adult who lives alone and sustained a minor cut while cleaning the basement. Or letter D, young adult who works in an auto repair shop and sustain a deep cut on a metal edge. So this is about tetanus. So of course here, the most at risk of the incidence is basically the very young, the very old. So we have chosen letter C, and older adults are more likely to be non-vaccinated or under-vaccinated. So tetanus usually occurs when a minor wound gets contaminated by wood, metal, or other organic material. So in addition, most people would not seek medical treatment for minor wounds. And farm work offers many opportunities for injuries, but most children are usually immunized before entering elementary school, and of course, it's better for the nurse to ask. Then people with deep cuts from industrial accidents are more likely to present to the emergency department for treatment. And of course, neonatal tetanus is more likely to occur in underdeveloped countries and is related to poor hygienic conditions during birth. Answer for number 11 is letter C. 12. A healthy but anxious 24-year-old college student reports tingling sensations, palpitations, and sore chest muscles. Deep, rapid breathing and carpal spasms are noted. Which action is the priority? A. Notify the healthcare provider immediately. B. Administer supplemental oxygen. Letter C. Have the student breathe into a paper bag. D. Obtain a prescription for an anxiolytic medication. Eliminate letter B and D. because the patient here is actually hyperventilating. There's loss of carbon dioxide. So the patient is considered to have hyperventilation that is brought about by anxiety, and the breathing 6 to 12 natural breaths into paper bag will allow the rebreathing of carbon dioxide, and have the patient remove the bag, breathe normally, repeat rebreathing into the bag as needed, and also encourage slow breathing will actually help. Other treatments such as oxygen administration and medication may be needed if other causes are already identified. Answer here, Charlie. Next, let's have another topic, which is talking about care of other clients in response to emergency situation. Question number 13. An experienced traveling nurse has been assigned to work in the emergency department. However, this is the nurse's first week on the job. Which area of the ED would be the best assignment for this nurse? Trauma team, triage, ambulatory, or fast track clinic, or pediatric medicine team? Of course, we know that uh, the fast track clinic deals with patients in a relatively stable condition. And a triage trauma and pediatric medicine areas should be staffed with experienced nurses who know the hospital routines and policies and can rapidly locate equipment. So 13, the answer is letter C. 14. The nurse and her friends are at the lake. Suddenly, someone says, "Look across the lake. It looks like someone might be drowning out there." What is the nurse's first action? A. Determine who is the strongest swimmer in the group. Letter B. Direct someone to locate a cell phone and call 911. Letter C. Find a boat, raft, or some type of flotation device. Letter D. Use a pair of binoculars and look across the lake. Of course, we know that the first that the nurse should do is to gather as much data as possible. In this case, data might include the number of potential victims, distance from the shore, hazards or barriers that may affect the rescue, such as temperature of the water, the roughness of the wave, presence of wind, or probably there is presence of lightning, and also the resources available to the victim or the rescuer, such as the boat, close rescuers. So this data can be reported to the 911 dispatcher and used to decide whether a rescue attempt is reasonably safe for the nurse and the bystander. Number 14, the answer is letter D. Number 15. The nurse is giving discharge instructions to a woman who was treated for contusions and bruises sustained during an episode of domestic violence. Which intervention is the priority for this patient? Discuss the option of going to a safe house, make a referral to a counselor, advise the patient about contacting the police, or make an appointment to follow up on the injuries. Of course, safety is always a priority for this patient, and she should not return to a place where violence could occur, and nevertheless, she retains the right to choose whether she goes. So the answer here is letter A. So the other options are important for long-term management of this case, but what is very important here is to establish safety of this patient. 15, alpha. 16, a newly graduated nurse overhears a senior emergency department nurse making sarcastic remarks towards a medical student and refusing to help the student find the equipment for a non-emergent patient procedure. What should the new nurse do first? A. Step in and offer to assist the medical student because the other nurse is unwilling. Letter B. Confront the senior nurse and indicate that an apology is the right thing to do. Letter C. Observe the situation and then report the behaviors of both parties to the charge nurse. Letter D. Watch and observe the dynamics. The scenario is probably typical of a unit term. So here, first, the new nurse should step in and take action to protect and address the needs of the vulnerable people, the medical student who's being bullied, and the patient who needs the procedure. The next step would be to take the senior nurse aside and discuss the behaviors and how they impact team morale and overall patient care. It is difficult to approach someone who is more senior, but the new nurse can use statements which are less accusatory. For example, I overhear the interaction with the medical student. I stepped in to help him because I felt uncomfortable. So observing the dynamics of the scenario is appropriate, and those observations can be shared with a charge nurse or unit manager so that steps can be taken to create a climate of interprofessional collaboration. 16, the answer, alpha. 17. The nurse notifies the emergency department healthcare provider about a patient who has abdominal pain, nausea and vomiting, and fever. The abdomen is distended, rigid, and board-like, and there is rebound tenderness. Later, the nurse sees that the patient is to be discharged with a follow-up appointment in the morning. The nurse re-examines the patient, and the symptoms seem worse. What should the nurse do first? A. Contact the nursing supervisor and express concern. B. Express findings and concerns to the healthcare provider. C. Discharge a patient but stress the importance of follow up. Or letter D. Follow the discharge order and write an incident report. So eliminate natin kagad yung letter C and D because that is discharging the patient. What is the answer here is letter B. Express findings and concerns to the healthcare provider. So the emergency department can be very hectic, and the AD staff should work as a team and watch out for each other as well as for the patients. If the healthcare provider refuses to consider concerns, then the nurse may have to contact the nurse supervisor and write an incident report. So this patient has signs of peritonitis. If the patient dies or has a poor outcome, the nurse is liable for failing to intervene. 17, the answer, bravo. 18. A confused patient admits to frequently drinking alcohol. The emergency department healthcare provider makes a preliminary diagnosis of pharynx encephalopathy. Which medication does the nurse anticipate that the healthcare provider will prescribe first? A. Glucagon. B. Naltrexone intramuscularly. C. Thiamine IV. Letter D. Naloxone IV. Of course, that is diagnosis for Pharynx-Korsakoff syndrome, or there's presence of pharynx encephalopathy, and that is caused by, of course, presence of thiamine deficiency that is manifested by possible confusion. There will be nystagmus and abnormal ocular movements. So it can actually be reversed with administration of your thiamine intravenously. There's a need of intravenous glucagon uh, if there's change of mental status that is caused by hypoglycemia, and then naltrexone is used to decrease for patients having craving for alcohol. The naloxone is used to reverse opioid overdose. Number 18 is Charlie. 19. When unexpected death occurs in the emergency department, which task is most appropriate to delegate to the nursing attendant? A. Escorting the family to a place of privacy. B. Accompanying the organ donor specialist to talk to the family. Letter C. Assisting in the postmortem care. Or letter D. Helping the family to collect belongings. Of course, we know that nursing attendant can actually help in the postmortem care. It requires turning, cleaning, at the same time lifting, and so on. And the uh, attending physician is able to assist with, or not, the nursing attendants is able to assist with these duties. And the registered nurse should take responsibility for the other tasks, such as helping the family, beginning the grieving process. And in cases of questionable death, the belongings may be retained for evidence, so the chain of custody must be managed or maintained. 19, that has to be letter C. 20. After emergency endotracheal intubation, tube placement must be verified before securing the tube. Which bedside assessment is the most accurate and can be performed immediately after the tube is placed? Visualize the movement of the thoracic cage, auscultate the chest during assisted ventilation, confirm that breath sounds are equal and bilateral, or check exhaled carbon dioxide levels with capnography. So here, the best answer is letter D. Checking exhaled carbon dioxide levels is the most accurate way of immediately verifying placement. And observing the chest movement and auscultating and confirming equal vital sounds are considerably less accurate. And of course, note you may possibly see the healthcare team auscultating the chest. This is a long time practice that is quick to perform and doesn't harm the patient if used in conjunction with other verification methods. Radiographic study will verify and document the correct placement. But here, we'll try to look into the levels of carbon dioxide through capnography. 20D. 21. The nurse is assigned to telephone triage a patient who was just stung by a common honeybee cause for advice. Which question would the nurse ask first? A. Is this the first time you have been stung by a bee or wasp? Or do you have access to and know how to use an epinephrine autoinjector? Letter D, what type of first aid measures have you tried? Or letter D, are you having any facial swelling, wheezing, or shortness of breath? So the very first thing that you need to do is probably assess if there is an involvement of respiratory issues. So the nurse would try to determine if the patient is having a severe allergic reaction to the bee sting, and that includes facial swelling. There will be wheezing or shortness of breath. It can rapidly progress to a life-threatening airway obstruction. So if these signs and symptoms are occurring, the nurse would instruct the patient to call 911 and use the epinephrine autoinjector if it is available. If the patient is not having a life-threatening reaction, the nurse could ask other questions to determine appropriate intervention. 21 is letter D. 22. A victim of heat stroke arrives in the emergency department. His skin is hot and dry. His body temperature is 40.6 degrees Celsius. He's confused and demonstrates bizarre behavior. His blood pressure is 85/60 millimeters of mercury. Pulse is 130 beats per minute. And respirations are 40 breaths per minute. Which task should be assigned to an experienced LPN or licensed practical nurse or licensed vocational nurse. Insert a rectal tube or probe to measure core body temperature, administer aspirin or another antipyretic, insert an indwelling urinary drainage catheter, or assess respiratory effort, hemodynamics, and mental status. So the answer here is letter C. So by merely inserting a catheter, that's actually within the scope of the practice of a licensed practical nurse and licensed vocational nurse. So experienced assistive personnel should be erected to insert the rectal probe to monitor the core temperature. Then the initial assessment of new patients and critically ill patients should be performed by the registered nurse. And aspirin and antipyretics are not given because they won't work to decrease the body temperature and may be harmful. The care of this patient would also include arterial blood gases, possible intrathecal tube intubation, IV fluids, blood for electrolytes, cardiac and liver enzymes, and complete blood count. Patient could also be given muscle relaxant if the patient begins to shiver, and monitor urine output and specific gravity to determine fluid needs, and cooling interventions and discontinuation of cooling interventions when core body temperature is already at the level of 102 degree Fahrenheit. 22, the answer is letter C. Insert an indwelling catheter. 23. The following patients come to the emergency department triage desk reporting acute abdominal pain. Which patient has the most severe condition? A 35-year-old man reporting severe intermittent cramps with 3 episodes of water diarrhea 2 hours after eating. An 11-year-old boy with a low-grade fever, right lower quadrant tenderness, nausea, and anorexia for the past 2 days. A 23-year-old woman reporting dizziness and severe left lower quadrant pain who states she is possibly pregnant. Or letter D, a 50-year-old woman who reports gnawing mid-epigastric pain that is worst between meals and during the night. So the best answer here is we need to have the assessment more, especially if there's a severe condition that is letter C. The woman with lower left quadrant pain could have an ectopic pregnancy, and that is considered to be a life-threatening condition. And the next one is the 11-year-old boy that needs evaluation to rule out appendicitis. Third is 35-year-old man has food poisoning, which is usually self-limiting. Then the fourth is a woman with mid-epigastric pain, may have an ulcer, but follow-up diagnostic testing and teaching of lifestyle modification can be scheduled with a primary healthcare provider. So the answer here is letter C. 24. The nurse is caring for a patient with multiple injuries sustained during a head-on car collision. Which assessment findings takes priority? Deviated trachea, unequal pupil, ecchymosis in the flank area, or irregular pulse. Of course, we know that if that is talking about the respiratory system, that's priority. The answer here is letter A. Because if there is a presence of deviated trachea, that's actually a symptom of tension pneumothorax, which will result in respiratory arrest if that is not corrected immediately. And the other options are considered potentially serious but of our lower priority. So the answer here is letter A. 25. A, a young woman is brought to the emergency department by emergency medical services because she has been depressed and threatening to commit suicide. On our arrival to the emergency department, the woman is confused. Her speech is slurred, and there is vomit on her clothes. EMS found several empty prescription bottles at the house. Which intervention is a priority for this patient? A. Identify toxic substances by history analysis of blood, urine, and gastric contents. B. Initiate supportive care such as checking the airway and giving oxygen and IV fluids. Letter C, reduce absorption by giving activated charcoal or performing gastrical lavage. Letter C, promote poison removal using drugs to facilitate excretion or by starting hemodialysis. Of course, we know that the very first thing that you need to do is, of course, priority of the airway. The answer here is letter B. Maintaining airway and, of course, administration of oxygenation and circulation are priorities. And the other steps are important in maintaining patients who have ingested toxic substances. 25, the answer is letter B. So that is it. Congratulations, everybody. See you again next time.